Welcome to the IFRS summary videos. These are summaries of lectures arranged by IFRS during the lockdown. Have a look at the original lecture for looking at the full lecture and also the videos. These are just small summaries of these. Today we're going to talk about LAVH or laparoscopic hysterectomies. The first hysterectomy was done in 1988 in Pennsylvania, and after which it became popular. But going back to the hysterectomies as such, it's not a uncommon surgery. In fact, the first recorded hysterectomy is way back before Christ by Soranus of Ephesus. The first abdominal hysterectomy was carried out by Charles Clay in 1843. And the first successful abdominal hysterectomy was Ellis Burnham in 1853. And the ovarian cystectomy in 1809. These indicate the surgery has been around for a long time, hundreds of years. In fact, even before that, in 1670, a lady who had prolapse of the uterus did a vaginal hysterectomy on herself. She was so fed up with the prolapse that she just cut it off. And the first abdominal hysterectomy, in fact, is done by an accident. And that is the reason that we said the successful abdominal hysterectomy is done by Ellis Burnham in 1853. And elective hysterectomy is again from the 1800s. But the modern vaginal hysterectomy, as we commonly perform now, was performed first in 1813. But in almost 100 years later, they popularized abdominal hysterectomies or vaginal hysterectomies for non-descent uterus. Then after some time, the laparoscopic hysterectomy, laparoscopy-assisted hysterectomy, and so on came into existence. And comparing all these things, LAVH is thought to be the most cost-effective and efficient way of removing the uterus. In fact, in the 80s, almost 70 to 80% of the hysterectomies carried out were abdominal. And the trend reversed a few decades later. And most of the hysterectomy is performed through the vaginal route. And then once the laparoscopic hysterectomy became available, and they devised a oscillator to cut the uterus into small pieces and remove it through the abdomen. And what about meta-analysis? What did they show? Many studies which analyze the various publications on this said that vaginal route is the best if it is possible. And it is much better than abdominal hysterectomies. Looking at the reasons for hysterectomies, there are a variety of reasons for which it's carried out. DUB or dysfunctional bleeding, menorrhagia due to fibroids, adenomyosis, prolapse, malignancies, sometimes even pelvic inflammations, infection, and ovarian neoplasms and pyometra and so on. These are definitive causes for which hysterectomies are carried out. And there are, what is given in green and yellow are relatively accepted causes for hysterectomies. But there are some inappropriate causes like white discharge, leukorrhea, cervicitis, prophylaxis against cancer, and primary dysmenorrhea. So these are not acceptable causes, but since it's a common surgery, many people have been doing this for these sort of indications also. Now looking at the advantages of LAVH, It is because it takes less operating time, because half the dissection is done in the abdomen and the rest vaginally. And the post-operative pain is much less. The complications are less. And recovery and getting back to work is less. And similarly, the blood loss also is relatively less. There are a couple of things you need to note when you're doing gasless surgeries. This is a big advantage because it's possible and spinal. And in fact, gasless surgeries are the biggest advantage for any of the pelvic surgeries. You need to make sure that the patient is in steep lithotomy position. And to prevent the patient from moving backwards or moving down, you need to make sure that the shoulder braces are there. The reason for this steep head-down position is that it's not the gases which push the intestines away from the operative way. It is the gravity which makes the intestines come down. And generally we drape the perineum and abdomen at the same time. One of the advantages here is that you can use the uterine manipulator to move the uterus around so that it's easy to dissect. And the special manipulators are available for total abdominal hysterectomies. And the full lecture shows the video of how LAVH is carried out. And summarizing, it is a procedure which is easy to carry, is safe, and probably the best option available for women who need hysterectomy. And it's even though there are many advances like robotic surgery and so on, LAVH still remains the best option in rural areas. Thank you.